Alex Ghenis. Welcome to the Trips and Global on Wheels podcast hour.
Hi, yeah, thank you for having me.
Of course. So I'm in Canada, as you may know, and I am in Washington D.C. And then my co-host Jean Mishner is in Melbourne. Jean, do you want to introduce yourself to Alex?
Yeah, hi Alex. How you going? Like Ming said, I'm calling from Melbourne, so it's a little bit early in the morning, but really a pleasure to have you here to speak with today.
Yeah, thank you for having me on. Great to, we got a few different time zones here, so looking forward to it.
Yeah, I know. We got 2:30 p.m., 5:30 p.m., and 7:30 a.m. So the first question is kicking off a little personal. I know that you have a C5 spinal cord injury, right?
Mm-hmm.
From a bike accident from a decade and a half ago. And then shortly afterwards, you moved to Eugene, which is where I went to school as well. I went to U of O, University of Oregon.
Great.
I did my undergrad. So what I want to know is, how does climate change affect you? Because I know it's your professional trajectory, and what is the personal stake?
Yeah, so I have a C5-6 spinal cord injury. Got it when I was 16 years old, just mountain biking and hit a jump wrong. And with a spinal cord injury, I have less control of my upper limbs. I have no control of my legs, as I mentioned. Kind of before this podcast, I have muscle spasticity in my legs. I have to deal with, managing medications and whatnot, always having those on hand. So on the one hand, I'm very aware that there's a reliance on the medical system, and the medical system, due to whatever might come about through climate change, could be endangered. We certainly see with the virus that's spreading around right now that epidemics and pandemics are going to be more intense when we have kind of humanity pushing in on forests, and then forests burning and more animals coming in, etc. And I know now I'm having to be much more careful about going outside. I'm having to be careful about managing my medications, talking with my doctors. So that's just one individual kind of small impact to one aspect of my disability. Other things I might deal with are air pollution from forest fires here in California. We've had forest fires, and due to my disability, I have a little bit less lung capacity. I know that could be an issue. If forest fires comes about, that I'll have more difficulty with breathing and with managing that. I cannot sweat to cool myself down. So if there's an extreme heat event, then that's something where I need to make sure I'm in a cool space. People with disability, and I'm a working professional, so I have money for an AC bill, but some people with disabilities who are reliant on really modest government income then wouldn't be able to afford that.
Later on, we'll break it down a little bit more. Just wanted to, see the personal effects, and, as someone, because it's very unique. I've done a lot of research on climate change over the past few weeks, just because of the guests that have come on, and I've rarely seen people with disabilities like ourselves who are experts or have any degree of knowledge in this field. It's very rare to find, I feel like. And since you've been in doing this kind of work for a lot longer than me, maybe you know more people and are more well connected in this area. So my next question is, so what is your biggest dream and hope in terms of progressing environmental / climate change work? Like, ultimately, what do you want to go with this in your lifetime?
Yeah, and actually, I'll take one quick step back. One of my concerns is climate-related migration. So people moving away from flooding coastlines. And I, here based in California, have built a professional and social connection to a lot of people in the Bay Area. And now I'm looking at the Bay potentially California entering a mega drought, a very deep mega drought, and we're reliant on snowpack. And in the back of my mind, then I also have, well, is Portland, Oregon, or Seattle, Washington an option for the future? So that's on the individual level. Here in California. Again, we've had a lot of wildfires. And down there in Melbourne, you know about wildfires. And actually, California firefighters and our air tankers fly down to Australia, and then the Australian firefighters come up here because we're different hemispheres, and summer and winter are different. And with the wildfires, people in California have looked at this and said, okay, we know wildfires are bad. They get sparked. People with disabilities have a hard time escaping wildfires in time. They have a hard time finding accessible shelter. They might have difficulty getting personal needs and medical needs met if they're in a shelter. And people just say, okay, this is an individual disaster that we need to work on. And then on the flip side, also in California, we've had an issue with the electric utilities, because actually some of these fires are sparked by poorly maintained equipment, touching trees, and that's kind of exacerbated by climate change.
So to continue, I want to ask you some intersectional questions. So how can we get more people with disabilities interested in combating climate change? As I mentioned at the beginning of this interview, it's hard to find people who have disabilities doing climate change, environmental degradation work.
Yeah. The most important thing in the disability community is not necessarily to get involved in the building of a green economy, but the building of a resilient society. When I look at climate justice, there's, in climate change, you've got mitigation, which is reduce the greenhouse gases so the world doesn't warm as much. And then you've got adaptation, which is, start moving people away from Miami or other low-lying areas. It's a scary concept, but it's something that we need to do. I think that adaptive climate justice is much more tailored to the disability community and getting involved than necessarily mitigation climate justice, bring the disability community into this, because we are going to get hit. We're most likely to be, I think, left behind, or at least not considered in adaptation. So that's where a lot of the focus needs to be. And I think that the disability community also needs to talk to the environmentalist community and say, listen, we know you want to phase out plastics, but I use a plastic straw. Can we figure out a less rapid, harmful transition plan to the green economy? So building those networks, and it's good because climate activists and disability activists both care about social justice issues in a lot of ways. So hopefully we can build those connections.
Mm-hmm. Yeah, thank you. As you were mentioning just now about plastic straws, right? It's the banning of them have had negative effects on the disability community, as we know. How can we reduce the use of plastics and help combat climate change while also maintaining the freedom, independence, and dignity of all people, and specifically people with disabilities?
It needs to be a gradual transition with input from the disability community. Berkeley, where I live, a lot of people know it as a very progressive place. Certainly there was very active and environmental advocacy community here. We have the Green Lining Institute downtown. We have a lot of others, and they pushed for a straw ban, but didn't consult the disability community here at the city level. So there's not enough recognition from the powers that be of the disability community. A lot of cities and things like that will have commissions on disability that work with the mayor or the city council, and then they'll have an environment commission and things like that. I think that at the governance level, there can be more kind of just engagement between the environmental goals and the disability community, because in the US, we're kind of having a little bit of an abandonment at the national level on environmental policy, including things like this. And it's being done at the local level. And this, again, goes to the disability community putting out fires all over the place. But it's outreach and it's dialogue. I try to talk to the environmentalist community as much as possible, the waste reduction community, the rest of it. And it's just something they don't think about when I talk to them. When you say it, it's intuitive, it makes sense. They say, okay, let's figure out a transition. But a lot of people just don't think about disability considerations. And they don't think about it. There's a few people in the environmentalist community that are, let's all go live in a commune in the woods. And I'm not going to be able to do that. And there's certainly some people that have seen overreach of society and say, burn it all down. Like, this is a monstrosity that society has built, right? And plastics are kind of the epitome of the thing that we've built that never goes away, that keeps on harming the environment. So the disability community, and really the entire medical field too, because of how much plastic is used for sterile medical equipment, things like that, just needs to say, we care about this. We need to jump in front of you and say, gradual transition, find alternatives. And we're happy to have that conversation, but don't just phase us out and kick us out of the way.
Yeah, no, me neither. I won't be able to live in the forest as well. Do you know any other people, as I was alluding to, people with disabilities that are working on these issues, that, the intersectionality of climate change and disability? If yes, who are they, and what do you admire about their work in this field? And of course, I'm talking about people with disabilities also doing climate change work. In the same community as you.
Yeah, so it's a lot of academics that are doing this, and there are so many disability activists that are doing great work on international development and human rights that now aren't, specifically disability and climate change, but are integrating climate change into their work. So, for example, Victor Pineda and the DIAUD, which is Disability Inclusive, something accessibility universal development. DIAUD, if you look it up, is the one that it is, and they now are starting to integrate climate change. The UN, and refugee agencies are recognizing, first of all, they already recognized climate change was an issue, and they already knew disability was an issue, and they're just connecting the dots, and I'm happy that's happening now. I've gotten a lot of outreach. Academics like Gregor Warbling is another one. But actually, I really love what DIAUD is doing. And then on the disaster front, the Partnership for Inclusive Disaster Strategies does a lot of international work, and they also are doing the climate change connection now too.
Oh, great. I didn't realize, so many organizations are making it a component of their organization. And then I think in I was watching some of your YouTube lectures, the lectures you've posted on YouTube. So just perhaps doing a summary, because I know you're covering it, how people with disabilities themselves can prepare and respond to disasters as they come.
So the Partnership for Inclusive Disaster Strategies has recommendations for individuals, and it's tough because people with disabilities are economically disadvantaged compared to the rest of society, and oftentimes government limits the amount of medical supplies, medications that they can have. Even being able to have a 3-week buffer sometimes of medications is difficult to work with, insurance or whoever else to provide. So people with disabilities should take the basic steps of having a certain amount of stocked up food, having stocked up medications. If you find that you go through a box of gloves once a week, then have several weeks worth of gloves. This whole thing, and make a list of everything medical you might need, make a list and contact assistance for personal care attendants, whatever that might be. I think people with disabilities should work in the community to educate their friends for the best ways to uh, prepare. That I think NGOs and government should help out with things like retrofitting buildings with air conditioning in areas that have a lot of people with disabilities and that might be affected by heat stroke, and people with disabilities can advocate for that. It really needs to be a dual track approach of people with disabilities preparing for themselves and government recognizing that people with disabilities can't do this all on their own, that government needs to assist, and sometimes it'll take investment to do so, and they should be involved.
And I think the COVID-19 pandemic is a perfect example. How have you taken measures to prepare for, even the first wave hasn't left, but the second wave, and just however long it's going to last? What tips do you have for people who are in similar situations?
I think the COVID experience, from me, where I'm at, having been a working professional, really emphasizes the value of economic empowerment for people with disabilities in getting ready and preparing for any sort of disaster, including COVID. I was lucky enough to have a little bit of a savings and a buffer to, stock up and have a little bit more of the PPE that I work with, that I use with my attendant, the personal protective equipment, just gloves and things like that. That we stocked up on food ahead of time. I'm vegetarian and always took little like pre-made packets to work with me and had some of those. We kind of had the prepper mentality with disability, and I'd worked here about this before. It's really important for people with disabilities also to cover the news just regularly to see what might be happening and coming down the pipeline. I was tracking this since November. When it came out, Berkeley, we went into lockdown in March, mid-March. And all the way going through that process, I was saying, you know what, I'm gonna buy an extra case of gloves just to have those on hand. And once I saw that toilet paper was running out, I just said, all right, I'll buy the stuff that they give to restaurants and split it with a few of my friends, and it's cheaper, and they were able to sell it. But looking ahead, preparing, I live with a live-in attendant, so my roommate also does some of my attendant work, and I had to work with my different caregivers and say, hey guys, Reggie's going to cover most or all of the shifts, and you can come in and be a backup, but we have to work with our attendants on doing that physical and social distancing. A lot of it is just following the news, doing communication. If you see something is around the corner, prepare ahead of time, because we do need a little bit more of the time buffer, because we just have, a few extra needs and a few extra things on the checklist.
Yeah, no, that's very, very crucial, especially with, personal attendants. They come in and out, and if there are multiple ones doing different shifts,
Yeah.
So the next question is more, is what questions do you have for leading environmentalists in the world? Say if you have them all in a boardroom or whatnot, a meeting room. What questions do you have for them on including people with disabilities in climate change discussions? What do they need to address? The main things they need to address for people with disabilities?
Well, I would say, first of all, get in touch with international NGOs that are doing a lot of this work or related work, DIAUD and Partnership for Inclusive Disaster Strategies. So immediately reach out to appropriate disability organizations, learn the basics. I think if I had questions for them, I would say, how many people with disabilities do you have on your staff and on your board of directors? how are you engaging the disability community? Have you considered whether some sort of green transition plan might actually create access barriers? The straws are one thing. If we have these new pod cars or whatever, elevated guideway, fancy transportation setups, but you only have an elevator every 7 blocks because they're too expensive to build on every station, that locks people with disabilities out of this green transition. So I would say, as you're building things, have you done the checklist on making sure that this is up to code? Have you gone beyond that and looked at, for example, the 7 principles of universal design to be even more what the government says? Have you engaged people with disabilities? How do you plan to engage people with disabilities? Do you have people with disabilities on your staff? And do you have my business card? I think might be the last question I give them.
Yeah, we'll have to organize that meeting now, huh? You
Yeah.
seem like you really had it on, had that question prepared. Um, and then next, which national or international climate change activists, leaders, or environmentalists in general do you see doing great work in including people with disabilities that others can emulate?
I'm grateful that the people that worked on the Green New Deal in the United States, they actually reached out to the disability community and asked for input, and a few of us gave input, and they added some more language around disability in there. So I think that every little bit of outreach matters. The UN Commission on Human Rights or Human Rights Commission, whatever it is, they've been pretty good, and also they work on implementing oh gosh, please help me with the international disability, the one that the United States is like the only country that hasn't signed yet.
Oh, the UN Convention on the Rights of Persons with Disabilities.
Thank you. This is a word I should know like immediately, but
yeah. No
so
worries. It's really long. It's a mile long.
But the UN, I think that their departments do talk to each other pretty well. So the folks in the UN working on disability issues also are talking with the refugee sections of the UN. So I wouldn't say necessarily that there's one big overarching organization that's doing this, but there's conversations and the people that realize, the organizations, the international groups that realize how interconnected all of this is. Some of the environmental justice organizations that started out looking at racial inequities are also including disability now. So like the Green Lining Institute in Berkeley and some of the things like that, they're recognizing the intersectionality.
Mm-hmm. Yeah, hopefully these starting to include and starting to inquire will just become a reality and not even a question of, oh, we should include this other billion people out there, right? Anyways, and then the next question, and then Jean's going to take over in a little bit here, is something you brought up. I was really happy you brought this up during one of your podcasts recently, a couple months ago. So you were saying that the need for the disability community to diversify in terms of activism, so that we're not preaching to the choir, because like it's a small community, and to a certain degree we'll start getting to know one another. It's only, the community is only so big. So what can we do to diversify though, to get out of this bubble?
It's like the spokes on a hub of a bicycle wheel. Is at the center of that wheel you have the local or national or international disability community, and people talk with each other and check in and learn the basics of disability rights, and have their pockets of advocacy that they go out and write letters, interact with legislators, communicate on that activism. But we need more seats at the table when it comes to just the environmentalist groups, when it comes to, you know, the transportation groups, when it comes to the energy and green infrastructure groups, whatever it might be. So instead of these kind of balls of activists going and then sharing their message, the balls of activists can go and then share their message, and then one person can jump over and sit on that commission to keep the discussion going. Because if we have someone here in, you know, the Bay Area that sits on the Energy Commission and says, okay, this is what we need to maintain power for people who use ventilators at home, that's better, that person sitting in on those meetings and contributing to that conversation, than a presentation by a group of 8 disability advocates for a half hour. So, you know, sit on the commissions, get involved, build the network, come back to the hub, and then go back out through the spokes.
Yeah. Yeah, that was very well said. Thank you. So now Jean's going to ask a few questions. Yeah, Jean?
Alex. And you also once said that, you know, if the sun isn't shining, how could you possibly charge your electric wheelchair? So what would be maybe some thoughts on, you know, the reliability of solar and wind power when thinking about powering essential devices?
Yeah. Well, this was during the power shutoffs, a big concern in California. We had a program that's certainly still not perfect, and they're trying to revise, but the past 6 months have been something. So that handing out large-scale battery systems. So, you know, the Yeti 3000 is like 3 kilowatt hours, I think is what it is. Generally, if you have a home or a system with well-placed, not only intermittent renewables, you know, wind power and sun, solar and the rest of it, but also a good setup of energy storage technologies and batteries, the ability of individual homes to just disconnect from the grid and have a big old battery or generator or whatever else there. That's what we need. We just need a more dynamic electric grid, and we need more widespread energy storage, and we need to have it at the broad level, you know, these huge wind farms and things like that, but also giving people that energy at their own home. And I think the ability then to cut off of the grid and have your home as its own little islanded power sourse.
It's funny that after I just asked that question, my experience in Melbourne is that, you know, we're predominantly coal fire powered, and yet we have many blackouts in the summer. So it's not just down to reliability of you know, the sun shining or the wind blowing. It's you know, do we have enough capacity or the right infrastructure with maybe power that hasn't transitioned yet, like coal power. Like that is a reality for people at the moment with existing power sources. And then it got worse when, you know, on a very, very hot day, if there are fires burning and transmission lines go down, that's just, you know, you're going to need some other type of battery power source, regardless of the source of power.
Yeah.
So,
well, and it's not only scary for me needing to charge my wheelchair at night, but also for someone that needs a 24-hour ventilator that only has, you know, maybe 2 hours spare battery on it. You know, these are, for me, it's convenience. For some people, it's life and death. And yeah, what you're talking about, not only that, but if it's a hotter day and then more people are turning on the air conditioner, then you've got more power demand at the same time that it's harder to provide it. I got into this working at the California Energy Storage Alliance, and I was working with them and thinking, how will I charge my wheelchair at night? And then said, this is bigger, and climate change, everything is connected, and that's when I switched over to this work specifically. Yeah, California, we're worried about it, and there's a lot of push to get people backup batteries. And I think Australia and California, we've got some similarities on that front.
Yeah, definitely. So the next one's a little bit different. Again, one of your previous quotes was, during times of panic, it brought on sorry, I'll start again. During times of panic brought on by a public health emergency, people with disabilities could be viewed as pariahs due to incorrect perceptions they were inherently having compromised immune systems. So what other prejudices and discriminations do people with disabilities face during public emergencies?
So certainly there's the pariah issue. I think that people with disabilities might be viewed as potentially more likely to transmit coronavirus or whatever else might be. People with disabilities often are left behind when emergency evacuation measures don't take them into account, which might lead to simply being stranded or perishing. Let me see here. If the power goes out, people with disabilities could have danger that way. If we get into a situation of really extreme kind of life or death triage, and people with disabilities are simply considered less likely to survive, then they could be put lower on that list. And a lot of this is really based out of misperceptions of the health of people with disabilities. I deal with my muscle spasms, but otherwise, in relatively decent health. I have friends who are blind and deaf. I have friends who have, diabetes and very well managed diabetes and things like that, where their health is, like, for the most part, fine. But someone would look at them and say, "Oh, you're an amputee. You use a wheelchair. Whatever. You're less likely to survive. So sorry." And we also run into the danger if social systems start to get stressed, if economies start to get stressed, that people who use those social systems can be demonized. People who are viewed as unproductive in a time of scarcity can be demonized. So if that's one of the side effects of climate change, that's something we need to be aware of, communicate, prepare, and then break away from.
Wow, some of those responses blew my mind. Just thinking about the initial stages of COVID and then the things that were being said in the media about triaging were truly just beyond horrific. And then to think that it might be exacerbated by incorrect perceptions, must be a real concern for anyone who isn't presented as the most perfect human being. So it's truly quite something that bothers me, because I mean, it's just so recent that people who haven't had that background with having to think about disabilities had all of a sudden had to think, oh, hold on, I might be considered less able or less fit or less healthy. Maybe I will also have to consider what happens to me.
Yep.
So,
and there's a connection between age and disability, and we've seen the really disproportionate rates of death among older folks. And right now in COVID, I've got able-bodied friends that are okay going out. As I said, I've got limited lung capacity. Otherwise I'm in good health, but it's something where a lot of my friends with disabilities are staying indoors. And we're also screaming at the able-bodied world of, people not wearing masks here in the United States and whatever else, and saying, like, listen, we know you want to go back to your job. You're talking about us as if we're expendable, and you being irresponsible about the mask means I have to stay home longer. Like, please just, stop discounting the lives of people you don't view as able-bodied. And one of my favorite quotes from Ed Roberts, the disability rights leader, is, "We're the one minority community that doesn't discriminate because anybody could join us at any time." And we need more empathy and humanity toward the disability community here.
Yeah, definitely. In fact, it just makes me think as well, like there can be short illnesses or short injuries where an able-bodied person might all of a sudden be classified as not able. And that only might be temporary, but it is something that everyone in their lives will probably have to think about, regardless of whether they become a permanent disability. Like, it might be, oh, I might have to use a crutch to get around town for a couple of months, or there are things in Melbourne, in our city, which have done really well, but I still think there is a perception that it can be only for people with permanent disabilities, but it really should be a thought of, well, almost everyone will probably have to be thinking about this at some point in their lives, regardless of whether they experience a permanent disability or not.
Yeah. And someone who is pushing a baby stroller benefits from a ramp. This is universally accessible design. Anybody can use that, whether they're able-bodied or not. So let's just build it accessible, and then thumbs up for everyone. Yeah.
I'm going to have to plug the Melbourne Tram system in the city. It is amazing. We went through a few years of redesign and construction, and it was difficult for a little while, but the results are truly amazing. And for me, who is able-bodied, to just have such a nice service, which even like for me, like there's no ramp, there's no you don't have to grab onto a handrail to pull yourself up onto the tram. The trams are in the middle of the road, and the priority is for the public transport, so that you're not fighting or worrying too much about the cars and bikes and things which are just going to come out of nowhere. So when it's built in a well thought out manner, not just for mobility reasons, but it can actually really change the way an entire city interacts, because all of a sudden I'm down the other end of the city, and it was just a breeze for me, and that should be the way it is for everyone, regardless of ability.
Yeah. And if you make it so that everybody able-bodied gets out of their cars and then uses the tram, that makes it so that if someone has a disability and it's at the level that public transport is difficult and they need to use a cab or their own wheelchair accessible van or something, then they can get there on the street because nobody else is driving as much, and probably find a wheelchair accessible parking spot easier. It's all interconnected. Yeah.
Yeah, I think that's a great transition spot to our next question. So Alex, I know you had kind of another life prior to climate change, or maybe this was during or in the middle, or parallel to, but so you were a former dating and relationship columnist, is that right?
Oh, you're pulling that one out. Okay, cool. Yep.
Yeah. So so one article wrote, I'm quoting over here, Ghenis was also the dating and relationship columnist Axel Grand for National Spinal Cord Injury Association's Life in Action magazine, where he covered topics including meeting people and getting physical, quote unquote. So his goal is to help people with disabilities have better understanding of our own sexuality and educate the entire public so that we are viewed as sexy and worthy of love. So my question towards you is, I think this is very appropriate for COVID-19 because a lot of people are indoors or isolated or by themselves. What advice do you have for people with disabilities who are looking to date during this pandemic? It's really tricky for anybody, regardless of if you have a disability or not.
Gosh, that is tough. I mean, for people who, I'm here looking over to the side as you're talking to me, just trying to think about how to answer this question, COVID specific. I started that actually when I was in college. I think my freshman year, someone else that had a disability said, you know what, we're looking around and none of our friends are going on dates. And we just decided to go around and start talking about it at, the co-op houses, and then the sexuality class, and then the disability studies. And this was just students going around and doing these conversations. So if anything, often people are kind of worried about disability when they see it in person right away at a first date. So the expansion of online dating, sometimes people with disabilities have to spend just some more time chatting before they actually go on the first date, just because they have to clarify disability. So this could be a decent way to kind of normalize disability without having to find the adaptive outdoor activity that would work for conventional dating. It's all right to talk to people from your home. I think it's a little bit more normalizing. It takes time, I think, for people that need that physical intimacy. If they can, be comfortable with it and find out a way to, help themselves, then more power to them. And otherwise, just being really safe. I think that there's, as I mentioned earlier on, the pariah thing is that if someone with a disability is, otherwise in good health, or feels like, they've been isolating, they talk to a potential date, the date has been isolating, they make it clear that, like, they feel comfortable. If they get sick, they don't know who got them sick, and there's no way that they would hold this person accountable. Obviously be as careful as possible, but communicate, let them know about any health worries, assuage any of their fears. I'm going to tell someone, if I get it, I'm not going to be in much of a worse case than anybody else, or say, I might be a little bit in worse shape. I think I'll be okay. I won't hold, you to blame or whatever. Be safe, communicate, be clear, try to normalize disability, and put yourself out there, have fun. I mean, if anything, this is a good opportunity to set up a dating profile and actually start messaging people and giving it a try.
And you're going to be the advice giver during this time?
I guess. Are we inviting me for another podcast? Just do dating advice?
Maybe. I had a follow-up question, which is, what's your recommendation? Is it to put the disability right out on the profile, or to reveal it later during the communication process?
I did online dating, and I'm seeing someone right now, which really I'm grateful for. We're able to be in the same home, and in that respect. But I put my disability right there on my profile, and I'm upfront about it, and I say at the end, hey, ask any questions. I'm comfortable with it. Like, my life is fine. I just roll around faster than you can walk because I've got a power wheelchair. Like, it is what it is. I thought it was cool because I'd gotten messages from, people who knew a family member, had a family member with a disability. Their roommate in college had a disability. They worked on disability rights. They saw some really cool thing. They've always been interested in it, but aren't kind of objectifying disability as some, like, intriguing, oh, fun, I'm gonna go on a date with this guy in a chair. Like, that's not who I want to be. But yeah, putting yourself out there, saying what it is, saying that you're comfortable with your disability and you're happy to talk about it if people want, that's my go-to. That's my advice. Yeah.
Thank you. That was great. Thank you also for all the great climate change information. Like I said, there's not enough people like you doing this kind of work, so I'm really happy that this is something you're passionate about, and are going to be doing for the long term. Well, as long term as the earth will allow it, right?
Yeah.
Anyway, so that's the interview. Thank you so much. That was really great. Jean, did you have anything to say to Alex in closing?
Just, it was wonderful to hear from you. I'm really glad that you've taken the time to go through all these issues with us. Yeah, thank you.
Yeah, absolutely. Thank you, and really appreciate it, and hope everybody listening stays safe.
Thank you so much. You too, Alex. Have a great day. Bye-bye.
Bye.
Did you like this video? If so, share with your friends and be sure to follow us on social media. And if you want even more resources, be sure to sign up for our email updates on our website, traipsingglobal.com. Keep learning new perspectives, Keep being inclusive because it will make the world a better place for you and for everyone else. Thank you so much for watching, and I'll catch you on another episode of the Traipsing Global on Wheels podcast hour.